Okay, now we have talked about the various ways we can protect our home and assets as baby boomers, but what about our health? You know, that's probably our greatest asset of all for enjoying the golden years of our retirement, as a change in health can affect any one of us at any stage in life. But it's not just enough to sign up for Medicare when we reach that qualifying age. It's really only the beginning of several healthcare choices in life that we need to think about at that time. Joining us now to help sort out all these choices available to us is Kristi Matus, Executive Vice President and Head of Government Services. Hi, Kristi. Thanks for joining us.
Thank you, Morgan. It's a pleasure to be here.
Great. Kristi, what are some of the misconceptions that people have about Medicare? And what can we expect basic Medicare to cover when it comes to our health needs?
Sure. There are two very common misconceptions about Medicare. The first is that it's going to cover all of the costs that seniors need to pay for their health care. In fact, there are significant deductibles both for hospital care, for doctor care, and there's no coverage at all in basic Medicare for prescription drugs. So the coverage that seniors might expect in basic Medicare is going to be significantly less, and it's going to cost them more than what they might normally expect. Second misconception is that buying supplemental coverage to fill in those gaps is expensive, and it's not. In fact, in many states you can get plans for a very low premium per month, and in some cases even coverage that's free.
So what does Aetna Medicare offer to supplement Medicare coverage? And what's the best choice to make when we first sign up for Medicare?
Well, Aetna offers many products that can help our senior beneficiaries with their health care needs. First of all, we offer a traditional Medicare supplement product that will fill in those gaps that I mentioned in traditional Medicare. In addition to that, we offer a Medicare Advantage program that in many cases is going to be very low cost and available to most seniors. And then finally, we offer coverage for prescription drugs that isn't covered through normal base Medicare. In terms of determining which products are right for you, it's very important to do the research, understand what benefits are included and which things aren't, and then make the right choice, not just based on monthly premium, but based on the medical care needs that you expect that you will have as you age.
Of course, there are many companies that offer this supplemental coverage. Kristi, what makes Aetna unique? How do you provide for someone whose health needs are constantly changing as they get older?
You know, I think what distinguishes Aetna better than anyone else is just simply the fact that we really care about our membership. We take everything that we know about them, and whether they're healthy or they're starting to have some health issues as they age, we make sure that we offer the best possible programs for them. For example, for healthy seniors, we work with them on wellness and preventive care to make sure that they can maintain their independent lifestyle as long as possible. But as we age, you know, we know it's inevitable that at times things are going to happen. When we have members that are aging and have health issues, then what we do is we provide them with nurses and case managers who can work with them and partner with them and their doctors and hospitals to make sure that they are getting the absolute best care possible.
So tell us more about this health care plan. How do you tailor it to each individual?
Well, the way we tailor it is that we really get to know our members personally. And so, for example, if you have high blood pressure, you will be able to be in a hypertension program. As you age and your issues become more acute, Aetna has a compassionate care program that is going to take people who have experience in working with others who have similar health care conditions, and it's going to work with the family and with the beneficiary to make sure that their care is coordinated and the best possible all the time.
It sounds very personalized for each individual member. How are these health care plans perceived by the healthcare industry?
Oh, they've been perceived very positively externally. We've been written up in peer magazines like Health Affairs and the Journal of Investigative Medicine. In addition, our compassionate care program is recognized nationally at one of the best in dealing with folks with extremely acute conditions. Finally, the Medicare program rates plans on a scale of 1 to 5. 93% of Aetna's Medicare beneficiaries are ranked in a plan that is 3.5 stars or higher. That's an incredibly high quality standard, so members can be certain that they're going to be receiving the best care in partnership with Aetna.
Well, so tell us more about this rating system. What does a 3.5 star rating mean? Sounds good.
Well, the STARS program was created by the federal agency that regulates Medicare. It's called CMS, and it was intended to help health plans work with the beneficiaries, again, to make sure that they are getting very high quality care. STARS is intended to do things like make sure that our members are satisfied with the care and the service that they're receiving. Secondly, it's going to make sure that Aetna works with our members to make sure that they take their medication and that they're adhering to the care schedules that doctors have set up for them. And then in addition, for healthy populations, STARS helps us encourage members to get the preventive care that they need so that they can stay healthy and independent as long as possible.
Of course, every baby boomer would love to live to be 100 while staying in perfect health, of course. And today's medical advances in technology are certainly helping us live longer. But we all know the inevitable will happen. So how do you prepare someone for that final stage in their life? What are the biggest challenges?
Morgan, that's a really good question. Preparation needs to start early while the senior is still healthy. And it needs to involve getting children or other caregivers involved so that they understand the expectation that the senior is going to have as they age and as they near end of life. As we age, some things are very common. We're going to start to lose our vision. Sometimes our hearing isn't as strong, and memory can start to fade as well. It's at those moments that making sure the folks that are going to care for you long term understand those expectations and partner with Aetna and the medical community to make sure that you are getting the care that you want and the best care possible.
So what kind of care plan or what level of service do you offer for those with advanced illness or nearing end of life?
At Aetna, we recognize that we are going to be helping members at the most difficult moments of their life. That's why we've created the Compassionate Care Program, which has been widely recognized nationally. Compassionate care is designed to help families as they transition through hospice and through end-of-life care. It involves Aetna providing them with trained nurses and trained case managers, so there are no surprises as they transition. I'm reminded of a letter that I received recently from a woman who had just lost her husband of 49 years. And as difficult as the situation was, she noted that through all of it, Aetna was there, and her quote was, "With Aetna, you have a lifeline." That's why we do what we do. We genuinely care about the beneficiaries that we serve. We want them to have the best care, the care that they need, and the care that they want at every moment of their life.
Kristi, thank you so much for all this valuable information about what's needed to supplement Medicare in our golden years. You've made the choices seem a lot clearer. Thanks.
Thank you, Morgan.
For more information on Medicare supplements and the Aetna Care program, log on to www.aetna.com. Up next, it's a life-changing phase of your life that could wipe out your financial security unless you plan ahead. Stay with us.